Hi everyone. We are tasked to record the chapter 6, which is the conducting research in clinical psychology. Learning objectives for this is describe the reason why clinical psychologists perform research, explain experimental methods as used by clinical psychologists, differentiate among various experimental designs employed by clinical psychologists, and speculate on the impact of technology on future clinical psychology research and indicate ethical issues that can arise in clinical psychology research. Why do clinical psychologists do research? First one for this one is for the treatment outcome. It changes in condition, reflecting favorable adverse effects on patients' well-being, and then outcomes measures must transcend impairment measures through meaningful functions indicators and all outcome measures attempt to compare a patient's progress or lack thereof between 2 points in time, typically an initial evaluation or to re-evaluation comparison, and also accurate diagnosis and rational treatment plan are essential criteria for the achievement of the three major goals of the treatment: aesthetics, functions, and stability. And there would be potential uses for the outcome measures, which is to help clinicians answer the questions or whether use is responding to the treatment they are being offered, and then to contribute to the equal quality to contribute to the quality evaluation of individuals clinicians practice as part of continuing professional development and performance review, and then also to evaluate the extent to which measured changes in a user is clinically significant, and changes that can make a difference to the everyday lives of users, and not just to statistically not to statistically significant, and to compare outcomes between similar services such as psychological therapy services provided to outpatient as part of community mental health team, or services for people with learning difficulties such as counseling services in primary care, family therapy services for children, and in different areas. And also to compare between individuals clinicians working in the same service in order to see if they are achieving comparable results, and as well as to compare outcomes between different user groups within the same services. For example, is the service of achieving better outcomes for user with depression than those with anxiety, or with white users than with those from ethnic minority groups, and as a pointer to the needs for further investigation or actions as part of quality improvements processes, and to contribute to performance monitoring and audit of service, and to provide performance and monitoring and audit of service, and to provide feedback of a service about the course of response such as recovery or deterioration for of those receiving help, and this would be also to provide information for the development of practice-based evidence to help build up a picture of effectiveness of various therapeutic approaches with a range of diversity of problems found in routine clinical practice, and to provide purchasers of services with data on efficacy and efficiency of therapy services, and to help purchasers evaluate different therapeutic orientations with regard efficacy and effectiveness. And also, there should be good therapeutic relationship, and since the relationship between therapist and patients appears so crucial. So to treatment success, experts have tried to find a good relationship. So one pioneering expert, Dr. Edward Burden, defined a good therapeutic relationship as consisting of three essential qualities, and it would be an emotional bond of trust, caring, and respect. Agreement on the goals of therapy and collaboration on the work or task for treatment. So for this one, under this first topic, which is the goal of the which is one of the reasons why do clinical psychologists do research is for the treatment outcome. And for more information about this, it is the result of medical intervention on patients' health and condition, and the study of the outcome of clinical interventions is an important area of clinical research for a number of reasons. Let's say, for example, uh, examples of potential uses outcomes measures includes to help clinicians to answer the question whether the users is responding to the treatment they are being offered. And outcomes are also results of therapy because targets and outcomes are very important intertwined. We will consider them together in the discussion though. And often use of this term outcome while we mean the broader concept of this also includes other targets. So the goal of therapy is to gain relief from symptoms, maintain or improve daily functioning, and improve quality of life. So if you have been in therapy for what feels like a reasonable amount of time and not getting better, talk to your therapist and explore other mental professionals and other approaches. So we will be discussing the other reason why clinical psychologists do research is for the efficacy and effectiveness. And first one, we will be tackling about efficacy. So efficacy refers to the power of treatment to achieve a given outcome, assuming that the patient is perfectly compliant and completes the treatment, and it is also the capacity to produce an effect and it is also a person's belief in their ability to complete task or achieve goal. It encompasses a person's confidence in themselves to control their behavior, exert an influence over their environment, and stay motivated in the pursuit of their goal. People can have self-efficacy in different situations and domains such as school, work, relationships, and other important areas. Efficacy is important because it plays a role in how you feel about yourself, whether or not you successfully achieve your goal. The concept of self-efficacy is central to Albert Bandura's social cognitive theory, which emphasizes the role of observational learning and social experiences and reciprocal determinism and personality development. And effectiveness, it is the capability of producing an effect, allowing to provide greater value to customers or clients, highly effective, continually to have satisfactory result, to achieve company goals, and effectiveness may also include the ability to accomplish tasks using limited sources. And for more information about the efficacy, uh, where, there. So, for more information about efficacy, as Bandur and other research have demonstrated, efficacy can impact everything from psychological state to behavior to motivation. And it also determines what goals we pursue, how we accomplish these goals, and how we reflect upon our own performance. So let's say, for example, one may set a goal to run a half marathon one day. Despite their lack of practice in running, they come up with a plan to run a mile a day. Even if they take multiple breaks along the way, given their hard, given their high self-efficacy, they believe they can run half marathon and end up doing so. So another example for this one would be college graduate is set to acquire a high profile job in position to have never been in before after graduation. They had internship in the past and have successfully accomplished the expectations set of them. So, with their high self-efficacy, they believe that despite starting new unfamiliar job, they will have the ability to quickly learn and adapt jobs, standards, and environment. And for more learnings, we will be for the effectiveness. Um, Being effective means that you are able to produce a successful result, allowing you to provide greater value to customers or clients. Highly effective employees continually have satisfactory results and achieve company goals. Effectiveness may also include ability to accomplish tasks as using limited sources. And next one is we will be tackling about internal and external validity. So for the internal validity, it increases the likelihood that a researcher can rule out alternative explanations for research findings. Establishing internal validity also facilitates external validity, or the extent to which findings study can generalize in real world context. So, excuse me. So, external validity makes the conclusions for causal relationship credible and trustworthy. Without high external validity, an experiment cannot demonstrate a causal link between two variables. So, internal validity examines whether the study design, conducts, and analysis answers the research questions without biases. And this is the degree of confidence that causal relationship are testing. The degree of confidence that the causal relationship you are testing is not influenced by the factors or variables. So let's tackle about external validity. This means how well the outcome of research can be expected to apply to another setting. This is important because if external validity is established, it means that the findings can be generalized to the similar individuals or populations. The general findings of a study to another situation, people, and setting, and measures. So without external validity, you cannot apply results from the laboratory to other people or the real world. The result will suffer from research biases like undercoverage bias. So there are two types of external validity. First one would be population validity, and the other one would be ecological validity. So for the population validity, uh, it would refer to you can reasonably generalize the findings from your sample to a larger group of people or population. From the word itself, population validity. So, population validity depends on the choices of population, on the extent to which the study samples measures that population. So, non probability sampling methods are often used for convenience with this type of sampling, and the generalizability of results is limited to populations that are similar to characteristics with the sample. And other one would be ecological validity. So, ecological validity refers to whether You can reasonably generalize findings of study to other situations and settings in the real world. So, for the example of I will be giving example for external validity. So, example for this one would be researcher conducts a study investigating effects of training program on early vocabulary development. The researcher it concludes the training program is effective after a sample of first graders exhibits an increase in their language abilities. So the researcher does several studies with other first graders and at different schools and finds out that the result is the same. And for another, let's just say that as what we have discovered upon our research for this one, uh, external validity asks whether the findings of a study can be generalized to patients with characteristics that are different from those in the study or patients who are treated in a different way, or let's just say patients who are followed up for longer durations. Excuse me. So let's say, for example, low population validity. Uh, you want to test the hypothesis that people tend to perceive themselves as smarter than others in terms of academic abilities. Your target population is 10,000 undergraduate students at your university. You recruit over 200 participants. They are the science and engineering majors. Mostly of them are American male, 18 to 20 years old, and from high school socioeconomic background. And in a laboratory setting, um, you administer a mathematics and science test, and then you ask them to rate how well they think they perform. And you found that average participant believes that they are smarter than 66% of their peers. And for the I will be giving also example under ecological validity. So for ecological validity, you want to test the hypothesis that driving reaction times can slower when people pay attention to others talking. In laboratory setting, you set up a simple computer-based task to measure reactions times, and participants are told to imagine themselves driving around their racetrack and double-click the mouse when they see an orange cat on the screen. For one round, participants listen to a podcast. In the other round, they do not need to listen to anything. After assessing the results, they found out that reaction times are much slower when listening to podcasts. So, for the next one, I will be tackling about assessment methods. So, for the assessment methods, this is to understand an individual's mental health and behavioral problems and how they may be helped. Three main purposes of assessment may include diagnosis, prognosis, and treatment planning, and identify underlying causes of an individual's symptoms and provide basis for developing treatment plans and tailored to their needs. It can also be used to monitor an individual's progress in treatment and make necessary adjustment. So, assessment methods will include but not limited to the following: a structured or semi-structured clinical interview, a thorough psychosocial life history, mental status examination such as appearance, mood, affect, and awareness, a review of developmental con- considerations, review for current psychological, social, occupational functioning, and a review of personality traits and behavioral assessments such as antecedents, behaviors, and consequences. And clinical testing and screenings using standardized assessment tools and diagnostic interpretation and prognosis. And The treatment for this one, another is treatment planning and recommendations, reporting and feedback. And life psychologists can also assist with matching appropriate psychologists and or provision of psychological treatment services. So psychological assessment can help identify underlying cause of an individual's symptoms and provide basis for developing treatment planned and tailored to their needs. And it can also be a monitor of an individual's progress in treatment and make a necessary adjustment. So, psychological assessment can help individuals and their families better understand the natures of their struggles and options available in addressing them. So, under this one, under the under this topic, which is the assessment methods. So, clinicians may also use standard tests to and checklists to help clarify aspects of an individual health and illness. And it is also used as an basis for identifying problems, planning interventions, and evaluating and diagnosing clients. It involves identifying statements such as actions and procedures to help individuals, groups, couples, and families make progress in counseling environment. And it is also to understand the individual's mental health and behavioral problems and how they may be helped. And I think that would be it. And my other group mates will be discussing the other issues. Other categories under how why do clinical psychologists conduct research.